Assalamu alaikum and welcome to Dr. Mraz Official. And in today's video, we'll discuss the role of psychology that is much more important for physiotherapists. And if first of all, if we will define psychology, so what is the psychology? Basically, scientific study of behavior and mental process is called psychology, and often it is used to solve your real life problem. So, if we will discuss two most important thing here. First one is the area for physiotherapy, the areas important areas for physiotherapy, and the second one we discuss the psychological illness of the patient, work on your patient, how would you work on your patient. So initially we will discuss the area for physiotherapy, which areas are important for a physiotherapist. The first one is assessment. Assess your patient accurately. Take the good history and symptoms of your patient. It will ease your treatment. The second important thing is that diagnose and decision making. Diagnose your patient properly. Diagnose that your patient have a muscular pain, or it has a nerve pain, or it has some other kind of injury. You should have to clear about this, and you should have to take decision quickly what you have to do further. The third thing is the planning treatment. Plan your treatment. Plan your treatment. Yet that if your patient have a Bell's palsy, if your patient have a stroke, and if your patient has something another thing like sciatica, so if you plan your treatment that I would treat this patient in a minimum time and I will recover this patient in a short time, this would play a very important role in your practice, in your good practice. The next thing is implementation of therapy. Implement some kind of things on your physiotherapy patient, on your patient in physiotherapy. For example, the first thing is that you have to educate your patient. Educate your patient about his or her disease, about his and her disorder, and advise the movements, how to move, and advise how to exercise. All these things are related to the implementation of therapy. The next step is alteration in therapy. You can alter your treatment regarding to the modalities. You can use different kind of modalities, and that will definitely help psychology. That will definitely breaks the barrier of psychologically to the patient. So the next step is that pain relief. This is most important step. You should have to relieve pain of your patient by using some electrotherapy, some modalities, and the very important thing is that the correct exercise. If you would do a correct exercise, that would definitely relieve the pain of your patient. And if you would recommend a good posture, that could also be very helpful in patient pain relief. And the next thing is that the duration of treatment and duration of session, that is one of the most important thing regarding physiotherapy. uh, Most of the physiotherapists, I think, don't give so much time to your patient. Even they give 20 to 25 minutes, that is not good time. You should have to give your patient 40 to 60 minutes at least, because in this time you can treat your patient accurately. So this is the first half. We have discussed the area for physiotherapy. Now we will discuss psychological barriers that are involved you and regarding your patient. So your work on your patient, we will call this your work on your patient. The first one is pain and discomfort. Your patient is feeling pain and discomfort. You should have to do something extra to relieve his and her pain and discomfortness. The second thing is the lack of interest and motivation. Your patient, uh, because of injury and because some other disorders, lack of interest and motivation, you should have to think something extra to take his or her interest in physiotherapy exercises, so that he get will soon. And you should have to motivate your patient. This is a very important point. And the third point is reduced self-esteem. Means in reduced self-esteem, patient is feeling esteem level because he don't know his and her value. So sense of self value is called esteem. And in when your patient reduces esteem, it means he is not aware about his and her value. So this is a reduced esteem, and you can take some extra step in reduced esteem. You can say that you are best or you are good at your work. You can motivate him and her, and you can take a challenge for 5 days to move your patient, and you can build a positive relation with your patient. So all these comes in esteem. And the next thing is insecurity and uncertainty. Most of the time, your patient feels insecure and uncertain because of anxiety and fear. You should have to cover his anxiety and fears by the psychological appliance. And the next thing is depression and anxiety, also related to the same point. Patient depresses soon and feels anxiety. And the next thing is disturbed memory and orientation. Patient memory feeling memory loss because of still on bed, and feels injured, feel discomfortness, and because of these discomfortness, the memory loss little bit. And the second important point is the orientation, ability to identify others. Patient would not able to identify others because he is ill, he is infected, he is injured, or some any other disorder. In these kind of disorder, the patient uh, inability to recognize other or to identify others. The next step is the lack of attention and perception. Most of the patient lacks attention and perception because they basically don't notice and realize things. And when the patient don't take a notice or realize things, this is called the lack of attention and perception. The last important thing is that about mood upset. Upset is another very important factor in patient. This is a mental health condition, and sometimes patient feel extreme happiness and sometimes feels extreme sadness. So this is the basically mood upset. And we can divide mood upset into four categories. The first category is the depression. Patient feels depresses that he can't get well soon, and some another kind of things. And the second important thing is that is the bipolar disorders. Patient in bipolar disorder, patient feels hypomania, means he's much and more overexcited at this time. And the third thing is premenstrual dysphoric disorder. And premenstrual dysphoric disorder, more than 10 days bleeding. And this problem is related to the females. If you have a female patient and she's feeling mood upset, this problem can be because of this premenstrual dysphoric disorder. And in this disorder, patient feels angry and discomfortness. And last point is that about disruptive mood dysregulation disorder. And in disruptive mood dysregulation disorder, the patients feel much angry. So in today's lecture, we have discussed the role of physiotherapy, the role of psychology in physiotherapy. I would recommend again to physiotherapists that please, in your daily routine of practice, psychology is much more important, because your psychology is the base of your practice. If you if you improve your psychology, then definitely you would improve your practice, you would improve your base. And when you improve your base, definitely it would play a very good effect on your practice. So all about in today video. In next video we will discuss another lecture. Until then, Allah Hafiz, Jazakallah.